Good afternoon and welcome to the City of Toronto's COVID-19 media briefing for Wednesday, February the 24th, 2021. Joining us today is Toronto Mayor John Tory and Toronto's Medical Officer of Health, Dr. Eileen. Mayor Tory.
Good afternoon and thank you, Brad. Before I talk about COVID-19 and related matters, I should just say that today is a pink shirt day, and I don't have a pink shirt on, but I have a pink tie on, and it's really a day that is supposed to raise our awareness about the insidious effect that bullying can have. And of course, bullying is not something that's confined to schools or to young people, but I think it's more prevalent there quite often. And today, bullying is way worse than it used to be, or its effects can be way worse because of cyberbullying that goes on. And I just hope that I'm sure there aren't too many kids that watch these media briefings, but I hope parents keep an eye to this, that kids, we try to tell them to speak up when they see it happening, to do something about it, but it's just something where all of us, I think, can gather together and make sure lives have been lost over this, lives have been ruined over this, and it's something that has no place, and we're just trying to show our solidarity with that cause today. I want to begin today by saying a simple word of thanks to all those who are sacrificing to beat this pandemic. There are a lot of people out there personally and in business terms that are making sacrifices to beat the pandemic. But I think people do understand, and that's why I'm saying thank you to them, because their behavior indicates they understand that following public health guidelines now will mean an earlier beginning to reopening and, perhaps more importantly, the avoidance of another lockdown later. The people ignoring the public health advice may get the bulk of the media attention, but I know that the vast majority of people are doing the right and responsible things in terms of their behavior. They are staying home as much as possible. They are wearing masks. They are keeping their distance from others. They're avoiding gatherings, and they're washing their hands. My sense of optimism is also based on the work that we're doing to support the provincial and federal governments in the rollout of the vaccines. This will be a team effort with all governments and hospitals and healthcare partners involved, and we will be ready to do our part at the city. The provincial government is responsible across the province for the system which registers and schedules vaccinations, for the distribution of vaccines, and for the determination of who gets vaccinated when. For the city's part, we have 4 of the 9 big city-run immunization clinics already set up and ready to go as soon as there is enough supply from the Government of Canada, and the news on that front is encouraging. And we are working with hospital and community healthcare partners to activate other vaccination channels as directed. But despite all of this optimism, we know that COVID-19 will remain a threat to people in the coming months, and that even if public health measures start to loosen, they won't loosen to the point where we can once again have the major events in the city that we all treasure, at least not as we know them. Unfortunately, this means that we won't be able to come together in person for a while longer to celebrate some of the festivals and parades that our city cherishes the most and that cause many, many people to come and visit our city. To keep fighting the spread of COVID-19, the city is extending the cancellation of in-person, city-led and city-permitted outdoor major events from March 31st to July 1st, including in-person Canada Day parades, festivals and events. Today's announcement, and I know this comes as very disappointing news to people, and it's no more pleasant to deliver it than it is to receive it, but today's announcement includes festivals and other large in-person gatherings held at outdoor sites managed by the city or other public locations, such as on roads or our parks or in our civic squares. Based on conversations with organizers, the vast majority of these major events will continue virtually in some way and are well advanced in planning for that outcome, namely to switch to a virtual event. Some of them had already taken the step themselves of indicating they would move to virtual and cancel the in-person event. But this list of those seemingly going virtual includes the Toronto Marathon, Half Marathon, 5K, 10K and Relay, the Sporting Life 10K, Canadian Music Week, the Juno Awards, the Ride for Heart, the North by Northeast Music Festival, the Enbridge Ride to Conquer Cancer, Indigenous Arts Festival, the Toronto International Dragon Boat Race Festival, the Pride Parade, the Trans March, and the Dyke March. I want to thank all of these organizations for understanding the need to avoid large gatherings in the coming months. Many of them had come to this conclusion themselves. And I want to thank as well those who have worked to offer virtual events to keep the spirit of these celebrations and in some cases the fundraising efforts going during these tough times. I strongly encourage the business community and as many Toronto residents as possible to continue to support these virtual events and to support, if they can, financially support the causes that these events in turn support on an annual basis. Major festivals and events require long lead times for planning, and they rely on city sites and supports and permissions. And so that is why it is necessary to make these decisions at this time, because a lot of the people planning events, say for July the 1st, would have to enter into contracts that would obligate them now, as opposed to some later time. And so they need to know now what is our best view with respect to the applicability of public health guidelines and so on. And due to large crowd size, these present higher public health risks given limits to physical distancing perhaps not being achievable and given exposure to attendees from people outside of the area, for example. Today's announcement enables event organizers to make sound decisions in support of public health, but also in support of their own business needs and the viability of their own organizations. And it allows them to access insurance, to support impacted employees, to manage sponsors, and to develop alternative approaches, such as virtual events, which many organizations have done so well during this pandemic. These decisions were made in consultation with Dr. Davila and Toronto Public Health, as well as the city's Emergency Operations Centre, the Toronto Police Service, the Economic Development staff, and major event organizers. You know, we're lucky because our city has not only some of the greatest events, but some of the greatest major event organizers in the world, with a deep commitment to public safety and an enviable track record when it comes to having huge events safely. I've been meeting personally with a number of them to ensure their relative well-being, the well-being of their organizations, and to offer any assistance that I can, both personally and through the city government. The city is committed to working in close collaboration with the industry. It's an industry of people who put on these events, some of them business organizations and some companies and some nonprofit organizations. And I'm working with them on a continuous basis, as will city officials be, in order to support a safe return to major events when it is safe to do so, with the operative word being safe. I want to be clear that this announcement does not include permits issued by the city's Parks, Forestry and Recreation Division for activities in parks and other city facilities or sites that are able to be permitted under the Province of Ontario's framework for reopening, or that may be permitted as we hopefully progress through that framework in the coming months. Professional sporting events are also not included in this decision. Those events rely on permissions from both the federal and provincial governments, as well as our own sign-off, and we have maintained and will maintain open channels of communication with all of our teams, our Toronto sports teams, throughout the remainder of the pandemic. I know that these major events and in-person city events will be back. Thanks to great organizers of great events, and thanks to you, they will be as strong and as enjoyable as ever. I look forward to once again taking part myself with millions of you in these events and celebrating our city in person and together. We've been working for several months on both plans to safely reopen and re-energize the downtown business district, for example, and all that goes with that. And we've been working as well on a plan citywide to give a boost to the whole city, including local neighborhood main streets and the smaller businesses which enliven them. With all of these plans, we just have to get to the point of pushing the green button. And to return to where I started today, I'm optimistic that people are doing today whatever they can to make that day come as soon as possible. I would now like to ask Dr. Davila to provide her report for today.
Thank you, Mayor Tory, and good afternoon. Today I'm reporting 389 new cases of COVID-19. 30 people have been admitted to hospital, bringing the total to 351, and 63 people are in the ICU. Sadly, I'm reporting one additional death. There are 72 confirmed variant of concern cases in Toronto. 71 are the UK variant, B117, and 1 is the Brazilian variant. 710 cases have screened positive for mutations of interest and are expected to be confirmed as variants of concern. When I delivered that figure on Monday, it was 511. So in 2 days, there have been 200 more screened positives, with the full expectation that within the coming days, these will be laboratory confirmed as variants of concern. The only trend I am prepared to cite at this point is that the screened positive total marches upward daily, and that should be a matter of concern to all of us. I remind you again that as much as you can, stay home, keep your exposure to the people that you live with, wear a well-fitting mask in public, keep as much physical distance as you can from people you don't live with, and wash your hands regularly. The variants are something to worry about, easily transmitted and in all likelihood capable of causing more severe illness. But they can be countered if we take the steps for self-protection we all know. I want to say, when I'm outside, I continue to be struck by the number of people who are masked. And I thank these people. I thank them for the message that they're sending. This is especially important in light of the fact that just a few moments ago, the remarkable data team at Toronto Public Health has just calculated the reproductive number for Toronto to be 1.1. This means that right now in Toronto, each new case of COVID-19 is giving rise to more than one new case of COVID-19 thereafter. It means that our epidemic is in a position where it is again growing. This is not where we want to be. We know now that we need this reproductive number to be below 1. And in light of the variants of concern and the modeling that I've spoken of before that was done by the Provincial Science Advisory Table, we know that we need to work together to bring that reproductive number to below 0.7. The good news is that much of this is actually within our hands. It's within our control. That's why I remind all of us, as always, to continue with vigilance in those measures for self-protection. Staying home, limiting your interaction with those outside your home, wearing a well-fitting mask as much as you can, especially when you're out in public, keeping your physical distance as much as possible from others, people that you don't live with, and to please wash your hands regularly. The more we all do our part in practicing the measures for self-protection, and especially as vaccines come along, and they will come along, the more we're able to do our part, the sooner we will get to where we all want to be, which is with COVID-19 in the rearview mirror and enjoying life in our city more like it used to be before there was such a thing as COVID-19. With that, I'll now hand it over to Brad and we'll take some questions.
Thank you, Dr. Davila. Just a reminder to please unmute yourselves before you ask your question. As well on the line, we have Chief Pegg, should you have questions for the Chief. We'll go first to Dave Woodward from Global News Radio. Dave, go ahead, please.
Thanks, Brad. My first question is for Dr. Davila. A colleague of mine was at Michael Garron Hospital earlier today, and he says there was a lineup out the door for testing at the time. Now, he was told that they were dealing with a backlog of tests. One, is that true? And if so, why are we still seeing backlogs of tests when all testing is supposed to be done by appointment only?
So thank you for the question. I'm not familiar with the circumstances at Michael Garron Hospital or the backlog of testing that you're speaking of. I understand that the testing system continues to be in play. This is something that is the responsibility of our provincial counterparts, but it is of course done by healthcare partners and healthcare providers throughout the community. I can certainly go ask my team about what they know of those circumstances, but I'm afraid I don't have specific information on that circumstance right now.
Okay, thank you. My follow-up, Dr. Davila, we know that if a student has one symptom of COVID, that they're being asked to stay home from school. But now that the province has brought in asymptomatic testing to some degree, is public health considering scaling that back to 2 symptoms or something different?
No, and in fact, my understanding is that the province has expanded its the use of this single symptom screening. And I would suggest to you that our move to use single symptom screening within our schools is one of many measures that we've advocated for in Toronto schools in order to make those environments as safe as possible. And it was premised actually on the experiences that we noted within the context of our schools. We found that it was a far more useful screening measure, and it created for a safer environment by actually taking children and removing them from the school environment, recognizing that there were a number of children who actually had single symptoms and subsequently went on to be diagnosed with COVID-19. So that's an example, I would say, of using our local experience and our local data to help direct our actions in as informed a manner as possible to make schools as safe as they can be.
Okay, thank you. We'll go next to Brian Passafume from the Toronto Sun. Go ahead, Brian.
Yeah, good afternoon, everybody. My first question is for the mayor. Your announcement today canceling events until July 1st. Obviously, it's a bit discouraging for those of us hoping that springtime will bring loosening of restrictions. Does this imply that the city expects the restrictions to continue for that long? And how do you react to those who say that we've been locked down long enough and it's time to start looking at opening up?
Well, let's separate the two. The reason, as I tried to explain, for the events to have their permits canceled now and so on was, and by the way, a number of these events, including Pride, the Sporting Life 10K, Doors Open, the organizers in the latter one being ourselves, the city, had canceled these in advance of this announcement today. But the real reason we have to move today on dates as far ahead as July 1st is because these organizations often have to sign substantial contracts to, buy or rent different things, and they need to know. And so, if you look at something like Canada Day, it's founded, the fun is in the crowd scenes that exist at places like Thompson Park and Nathan Phillips Square and Mel Lastman Square, and the notion that we'll be having crowd scenes like that will be whatever stage we're at, crowd scenes like that shoulder to shoulder just doesn't seem to be consistent with reality. And so it's better to give them notice that says don't go out and sign these big contracts because we don't think that those events are likely to happen at that time. In regard to the broader question of how long we've been locked down, I've already indicated that I think, that people really should put in the maximum effort over the next couple of weeks to hopefully help get us to a stage where we can begin a process that is going to, see the city reopened. I think everybody wants to see us move out of the lockdown situation as soon as possible, but making sure that when we do so, we're not heading back towards another lockdown later. And I think I began my remarks today by thanking people for their cooperation in that regard, because I think people are trying their best. But we've still got a lot of work to do before we can, sort of say that we can just go back to business as usual. And I think I'm just being honest about that in reporting the things I did to people today.
All right, thank you. My second question is there was reports today that the CNE was expecting to go ahead as normal this year. Well, not as normal, but I guess go on with the show. How does that fit in with what you've announced today? I know the CNE is after July 1st, but how does that fit in with the CNE planning to reopen?
We've been very careful to take things up to July 1st today, because that seems far enough ahead to take account of this business of people having to sign big contracts to rent things for something as far away as Canada Day, but closer than you think. We have not dealt with the period into August when the CNE would happen, or for that matter, the Royal Winter Fair, which is also talking about doing a virtual event. I haven't missed those two events in any year since probably I was a boy, the Royal Winter Fair or the CNE. There's nothing quite like being in a big shoulder-to-shoulder lineup at the food building, for example, or in front of one of the rides, but that's just the issue. And it's hard to predict the future, so I think as a result, we will leave over exactly what they mean by having an in-person event and exactly what we think will be something that we can do safely until we get much closer, and we'll be happy to have those discussions in the meantime with them, but I think it's too soon to predict the future in terms of whether things are likely to happen in person or not. Hope so.
All right, thank you. We'll go next to Mark McAllister from City News. Mark, go ahead, please.
Thank you very much. Perhaps to both Mayor Tory and Dr. Davila. You had pointed out there's a distinct difference between the province and the city's responsibility for vaccine rollout. As of today, 4 of 9 clinics you said are now set up. However, they're sitting empty. How will you coordinate the on-the-ground logistics for what seems to be a very complex provincial framework for that rollout?
Well, maybe I can start in the general terms just by saying this. We have said from the beginning that we'll be ready to carry out our responsibility, but let's look at how this thing is structured. We are partners with the province of Ontario, but they are in control of the booking and registration system. They're in control of the distribution of vaccines, and they're in control of the priority setting for who gets vaccinated when. So I would say that makes them, in effect, the managing partners, but we are their partners. They're the managing partners. And we have said all the way along, and Chief Pegg has done a great job at getting these mass immunization clinics, which are part of what we will help with, up and running. But we're doing everything we're doing basically in concert with, but under the direction of our managing partner, and we will be ready to do our part when the time comes.
So perhaps I can pick it up from there and speak specifically about the experience that Toronto Public Health has in actually implementing and delivering large-scale immunization clinics. And we do have a great deal of expertise in this arena. Every single year, we run school-based immunization clinics, and they can be quite sizable. We also run flu immunization clinics and have had a long history of doing that, although increasingly in the last few years, we've focused our efforts more so on populations who have more challenges accessing flu vaccine, for example. And of course, I would speak to the experience of local public health in delivering large-scale mass immunization clinics back in the H1N1 pandemic in 2009. Those memories are still quite fresh for many of us who were actively engaged in those efforts. So we do have quite a bit of experience when it comes to the local implementation. All we need are the vaccines, the sites as they're coming online for the delivery of those vaccines, particularly in those mass immunization clinics. We expect that the delivery will, over time, as vaccine supply becomes more available, will involve other partners, health sector partners, and ultimately, from what we hear through our provincial partners, pharmacies and doctors down the road, who are also actively engaged in the delivery of vaccine on a regular basis. So we just need vaccines here at the City of Toronto, and we'll be ready to go.
Can you explain, beyond the high-risk groups that have been identified as a first priority and part of the province's phase 1 rollout, can you detail how you will get people perhaps in those communities and populations that we've also spoken about where COVID has been hit the hardest? How will you get those people vaccinated as part of the early going as well?
So why don't I start off with that, and we'll see if others have comments they wish to make in this regard. So right now, when it comes to that which the City of Toronto and Toronto Public Health are planning, you've heard about the mass immunization clinics. Chief Pegg has certainly spoken about those clinics, and you've mentioned a few, Mark, just now. But envisioned as part of that plan as well are mobile immunization clinic opportunities, and as well some focused response efforts, meaning pop-ups, clinics that get set up on a more temporary basis in areas where those are needed. That doesn't even speak at all about the kinds of things that health sector partners are actively planning for and considering at this point in time in order to get to all the different nooks and crannies in the city. They too are thinking about mobile clinic undertakings and how they might actually bring clinics to people, particularly those who have challenges with mobility or challenges getting access to some of the more established sites. And as I mentioned, over time, as vaccine supply becomes available and pending the nature of the conversations and plans that happen with our managing partner, if I may borrow the mayor's term, the provincial government, I expect that over time there may be the involvement of pharmacies, which are scattered far and wide across the province, and as well family physicians. So the plan is to have, I think, vaccine made available in as many different ways as is possible, and a lot of that will rest with the partners who are engaged in vaccine administration and its planning.
Mark, I'm going to throw to the chief, but let me just add that we will also have a very targeted yet widespread multilingual campaign to very specific communities in the city. Chief, did you have anything more you wish to add?
Sure. Thanks, Mark, and thanks, Brad. Perhaps what I can add just in relation to the last two questions, actually, is just to highlight, Mark, that there is daily and nonstop coordination ongoing that, in fact, has been ongoing since the fall of 2020 and then even before that, whereby, in one hand, or part one, we are directly connected with the province of Ontario via the Vaccine Distribution Task Force, and at the same time are operating two very robust processes for our own purposes in the City of Toronto. One is the city's immunization task force, and of course that wrapping up or reporting up into our COVID-19 strategic command team. Both of those teams operate daily, and I think it's important to note, Mark, and you may be interested to know that we regularly expand and adjust the scope of operations for both of those, if you will, in response to the demand. And most recently, we have continued to expand the scope of immunization task force operations, and that's really simply leveraging the, I would say, the scalable nature of our overall incident management system. So we are well coordinated, directly connected, of course, with the province, and have very robust processes in place to make sure that all aspects of these operations within our city are connected and ready to go as soon as vaccine is made available.
Thank you, Chief. We'll go next to Dave Ryder from the Toronto Star. Dave, go ahead, please.
Hi there. First question for Dr. Davila. So the numbers you gave us today, we have the reproductive value climbing from 0.81 to over 1, and then we also have a relatively low number of deaths, understanding any deaths is too many deaths. I'm hoping you can parse that for us. What do you think is going on as far as the impacts of the variants or vaccine? What can you tell us about what you're seeing happen when you look at those numbers?
Well, David, thanks for that question. I don't know that I can give you a complete and total picture, but I can certainly, provide some insight into what we're seeing on the ground. We know that over the course of the pandemic, amongst those populations that were hardest hit were residents of long-term care homes. And in fact, the majority of the deaths did occur within that setting, particularly earlier on in the pandemic. And each and every one of those, it's tragic. And I certainly feel that loss, and will send my sympathies to all those who lost loved ones as a result of COVID-19. On a more positive note, what we are seeing is now that those long-term care settings and retirement homes have had the opportunity to receive vaccine, they've certainly been offered vaccine within those settings, we are seeing a decline, one, in active outbreaks, and two, in deaths in those settings. So I think this is very, very positive news around the vaccine, and it certainly gives us all hope at this point in time. So, as vaccine becomes more and more available, the hope is that the benefits that are being experienced now within the long-term care settings and within retirement homes will soon be a benefit that's experienced more broadly within the community. That's certainly what we would like to see. Looking at our numbers, with respect to that reproductive number, I will tell you that it's certainly not where we want to go. It was disheartening for me to see that number. We were at a reproductive number, as you recalled from last week, at a little over 0.8. To be at 1.1 now is not the direction that we want to go in. But to, bring this more to a positive note, we know that this can be controlled. We know that this is largely, not exclusively, but largely within our hands. For those of us who have the ability to work from home, to work remotely, that allows for that greater opportunity to really stay home and to not interact with others outside the home. To the greater extent that we can do this, we know that that will make a difference. We know that how this disease spreads, and we know that we do control much of that. So I would encourage people to continue to follow those measures for self-protection. We're getting close, right? We're almost there. Vaccines are coming in the next several weeks. They should be more broadly available for all of us to benefit from. So, if we can just keep pushing ourselves a little bit more, I know how very tired and frustrated all of us are with this pandemic, but just a little bit more effort, a little more vigilance with respect to self-protection measures, because we're almost there.
Thank you. And then following up on that, I'm hoping you can talk about what you're seeing, if anything, or what Toronto Public Health is seeing in schools as far as the number of cases or the variants, and whether the return to school is playing any role in the increase in the reproductive number.
So at this point, David, I would say it's early to say that. We know that as people interact with each other, and that includes schools, that there is the opportunity for virus to spread and to transmit within settings. Any setting where there are people together is an opportunity for virus to spread. So certainly we expected that as schools returned to in-person learning, we were expecting that we would see cases within those settings. And in light of the fact that there are variants of concern in the community, we expect, and we should expect, to see variants of concern within schools. I would remind people of a couple of things. One, we know that many of the cases within the schools actually arise from transmission within the community. So some may arise from within the school, but many of them will be driven by the activity that's happening in the community. That's certainly what we saw over the course of the fall, and I would anticipate that that would continue. I think the other piece that I would offer is that right now, knowing what we know about the presence of variants of concern in our community, we are treating every case out of an abundance of caution. Every case that arises within the context of a school will be assumed to be a variant of concern until proven otherwise. And again, that's being taken out of an abundance of caution so that we can create the safest environment possible within our school settings to allow our kids as much as possible that benefit of in-person learning.
Thank you. We'll go next to Nicole Thompson from the Canadian Press. Go ahead, Nicole.
Hi, I have a question about the situation in shelters, so maybe best for Dr. Davila and also Marianne. I'm wondering first when we can expect a wider rollout of the vaccine to the homeless and also shelter workers. Like, where do they rank in the list of priorities?
So why don't I start off with that? Taking a look at the provincial framework, because again, the province is responsible for that prioritization framework. And as I recall the details of the provincial prioritization framework, those who are providing frontline healthcare type work within the context of shelters, people who are actually working directly with shelter populations are, I believe, considered within the latter part of phase 1. That's the phase that we're currently in, and that should take us through, according to the provincial framework, to the end of March. My understanding is that those who live in high-risk congregate settings, I believe shelters would be one of those. And again, I would ask you to look at the details on the provincial framework. As I recall, that particular population is envisioned as receiving vaccine within phase 2, which according to the framework of the province begins in April.
Marianne, anything to add, please?
Thank you, Brad. I'll just add a few more details in terms of how we're preparing. As Chief Pegg talked about, the preparation is as important as the rollout. So we've been partnering with Unity Health. They've conducted 3 pilot vaccination clinics at shelters, one in a senior shelter, one in a hotel shelter, and also one with one of our Indigenous partners. And really just sort of identifying how those pilots work, what the receptivity is to vaccines, so that when we go to a broader rollout, we have an excellent playbook that will be successful. Internally, we have also been key partners with the Vaccine Task Force under the leadership of Deputy Chief Jessup. We have people at the table working to make sure that we are ready for when vaccines are rolled out. We anticipate to staff across the shelter system first, as the doctor mentioned. Those are in phase 1, and then when we move to phase 2 for shelter residents.
Okay, thank you so much. And then my second question is actually also about the shelter system, specifically the outbreaks going on and the one at Maxwell Meagan in particular. I'm wondering, with residents coming and going throughout the day and different throughout the week, what is the plan for isolating people who may have been exposed but haven't yet tested positive for COVID?
Marianne, if you could address that, please.
Yes, we will. So we are doing isolation in place at Maxwell Meagan, and that was based on our discussion with public health and the risks involved with, moving large amounts of people being actually more disruptive for the people involved and for public health. So we're working very closely with public health and with the Salvation Army, who runs that program, to ensure that we are keeping isolation for the 120 people that remain on site, and working with them to make sure that there's as minimal as possible coming and going, and that we make sure that residents are provided with an isolated space to go outside to smoke. They have a fenced area so that residents can still partake in those activities, and they have access to entertainment inside and sleeping areas inside and programming, and as much as possible to offer them an engaging program to make that isolation period go quickly. We will be doing on a daily basis screening of staff and of clients, and ongoing testing. In fact, there's additional testing being done in partnership with public health today. So we will continue to monitor that and work with the shelter provider to make sure that that's being well managed.
Dr. Davila, if you could add, thank you.
So thanks. I think Marianne has covered many aspects of the response quite nicely. I would just add this from a public health perspective. We recognize that these are very challenging circumstances to manage, and really what we're trying to do in partnership with the operators of the shelter and our colleagues, Marianne and her team at Shelter Support and Housing Administration, how do we best provide for an environment that enhances the safety of those who were exposed within the context of Maxwell Meagan Shelter, and as well minimize further transmission risk. So it's a very delicate balance that needs to be struck, a very unique set of circumstances, always within the context of shelters, and one that requires the partnership of all parties: public health, Shelter Support and Housing Administration, the shelter operators, and of course the clients themselves. So, I can assure you that we are working as hard as possible with all of these partners to create the best circumstances, both for the clients of the shelter and for others who they might come into contact with, seeking to minimize that opportunity for further transmission.
Okay. Thank you, Dr. Davila, and thank you, Marianne. We'll go next and final question to Richard Warnica from the Toronto Star. Richard, go ahead.
Hi, question for Dr. Davila. Dr. Davila, I'm just wondering if, based on the first, I guess, 7 or 8 weeks of the program where public health is naming individual businesses with outbreaks, whether you've seen anything of the fear of people who were against that idea of businesses not cooperating with public health playing out. In other words, have you seen any drop in cooperation from businesses now that you're naming individual businesses with outbreaks?
To my knowledge, Richard, no, we're not actually seeing that. Of course, we're continuing to monitor this. We're, in the first few weeks of this new approach to naming workplace outbreaks. We'll continue to monitor that for now, but at this point in time, I don't have any evidence of that.
Has anything surprised you in the first couple of weeks of this program? Anything that you've learned or anything that's come out of it that you didn't expect?
I don't know that there was anything that was entirely unexpected, but I would say this, there is learning every single day in the middle of a pandemic. So there is, as I said, I'm not sure that there would be things that I would characterize as particularly surprising, but I, honestly, am learning every single minute of every single day as we go through this COVID-19 response. And, I don't think that that's surprising in the context of a pandemic.
Okay, thank you very much. That concludes today's briefing. Our next scheduled briefing is this Monday, March the 1st. Stay well, everybody. Thank you.